Welcome back. I'm Dr. Bob, and on Health Today, we're going to talk about weight loss. Some of you, like me, probably struggle with maintaining a healthy weight. It's a complex and common problem. Food plays such an important role in our lives. It's much more than just a source of energy. It's the center of many of our family and social traditions. Think about around the holidays how many of your traditions involve food. Some of you may have asked your doctor for advice on how to lose weight and probably were received with the advice, eat less and exercise more. That's a simplistic approach, and while it's true that calories consumed have to be less than calories burned to lose weight, it's much, much more complicated than that. It has to do with the source of calories, our hormone status, the function of our digestive tract, our genetic factors, and many other factors are involved in our ability to lose weight with a reduced intake of calories. The decision to lose weight is a very personal decision. It depends a little bit on your overall health status. You're all familiar with the health effects of obesity. It can affect kidney function, lung function, heart function. It can affect your hormone status, including diabetes or prediabetes. And it can affect your joints. Joints can wear out prematurely with carrying extra weight. So when you finally make the decision that it's time to lose weight, how are you going to do it? Diet and exercise are still the first step, but many of you, like me, have tried most of the fad diets with short-term success but long-term failure because it's hard to make the lifestyle change that's needed to maintain the weight loss. I'm reminded of a joke that I've seen that says, "Nobody wants to hear about your diet. Just shut up, eat your lettuce, and be sad." My thin friends keep telling me about runner's high, but all I know about is donut high. It's a short-lived and instant antidepressant. And in fact, depression plays a significant role in our ability to maintain a healthy weight. We'll circle back on 2 separate episodes about diet and exercise, but they really are critical to weight maintenance once we lose weight. In today's episode, I want to focus just on medications for weight loss, and the reason is that there's been an absolute revolution in medications for weight loss over the past 4 years. Most of you are familiar with a drug called Ozempic, and we'll talk about that. But first, I wanted to give you a little background on medications for weight loss because it's quite alarming. The first medications approved for weight loss were in 1933, and the FDA approved drug after drug for weight loss, and most of them were an absolute disaster with terrible complications and side effects, and subsequently all of them were withdrawn from the market up until 1999 when a drug called Orlistat was approved, and it has remained on the market. Orlistat is a drug that has some side effects that include diarrhea and stomach bloating and other effects that most people find unacceptable, and so it's not really caught on as a first-line drug for weight loss. Also, the weight loss with it was estimated about 3% in most studies, and the trade-off for 3% weight loss with the side effects for most people wasn't worth it. Most of you are familiar with what happened with Fen-Phen that was approved by the FDA subsequent to that, and had terrible complications of heart valve damage and removed from the market by the FDA, although phentermine, part of Fen-Phen, is still available on the market, and it's available alone or in combination with other medications. But again, the weight loss with phentermine and phentermine combination drugs has been pretty mild in the 4 to 6% range. The revolution began with a drug called liraglutide. The way this drug works is it's a GLP-1 receptor stimulator. And what it does is we've got these receptors throughout our body called GLP-1 receptors, and these drugs target that receptor. They're in our intestinal tract, but they're also in our brain and other locations throughout our body. And by turning on that receptor at low doses of these drugs, what they do is they slow down stomach emptying, which gives us a sensation of fullness, and it also slows down emptying of our intestinal tract that gives us some feeling of fullness as well. But at higher doses, they actually work in the brain, and they activate the satiety center in the brain, which is the part of the brain that tells us we're not hungry anymore. But they also work at higher doses in the brain where they trigger something called a satiety center, which is the part of our brain that tells us that we've eaten enough, and essentially are appetite suppressants in the brain, in addition to their effects on our intestinal tract. The problem with liraglutide, or brand name Victoza, was that it's a fairly short-acting drug, and because of that, the weight loss was in the 4 to 6% range, similar to what other drugs in other classes had produced. After liraglutide, the next generation of drugs is one that you're probably familiar with, Ozempic. It's currently the most prescribed drug for weight loss in the United States. The difference between Ozempic or semaglutide, its generic name, and liraglutide or Victoza, the prior generation, was how long it stays in your system. The semaglutide or Ozempic stays in your system for a week. It's given by injection, has to be given once a week. But because it lasts longer, it's a more consistent result, and the weight loss was a dramatic 14.5% compared to the 4 to 6% with the prior generation or liraglutide. There's also a next generation or a third generation of these drugs that have two trigger receptors that they activate. The GLP-1 receptor that the other two trigger, but also a GIP receptor. And we don't know exactly how that GIP receptor works, but what we do know is that early studies on this drug called Mounjaro is the brand name. Tirzepatide is the generic name. Has been described as by the Wall Street Journal as the King Kong of weight loss drugs. It resulted in a weight loss of 20%, which is unheard of with medications for weight loss. And again, the compliance or the maintenance rate with the drug has been really quite good. All of these are diabetes drugs initially, but they've shown such dramatic effects on weight reduction that they're rapidly being approved for that weight loss indication by the FDA. And so far, and granted it's early in this process, the safety profile has been pretty good with these drugs. The most common side effects are gastrointestinal upset, nausea, vomiting, constipation, which are expected with slowing down the intestinal tract. But we don't know the long term. Remember that fen-phen was on the market for several years before we realized that it was causing heart valve damage. So again, I go back to that healthy skepticism when it comes to weight loss drugs, and looking back at the history, going back to 1933 and seeing how many of these drugs have tried and failed to result in a healthy weight and maintenance of that healthy weight. In fact, the studies so far show that there's about a 2/3 weight regain when these drugs are stopped. And for me personally, that's one of the biggest concerns. And that's where we'll get back to diet and exercise for maintenance, because it's not realistic for non-diabetics to stay on these medications for a lifetime, partly because of the cost of the medications is extraordinarily high. They can run between $10,000 and $12,000 a year in some cases. They're relatively new, and we expect that cost will come down as generics become available and there's more competition in the market with new drugs making older generation drugs less expensive. But there's several reasons to worry about long-term use of any medication for weight loss. And really, at some point, diet and exercise need to kick in for maintenance therapy, and we can't expect to rely on lifetime use of medications for weight loss. From my perspective, the key to weight loss medications is to get us over the first hurdle of losing the critical weight that allows us to be more physically active and to make the lifestyle, buy us time to make the lifestyle changes that are necessary for maintaining a healthy weight. And that's, I think, where these medications will be useful. There's also some early data on the combination of weight loss medications combined with surgical procedures for weight loss, and we'll talk more about surgical procedures in a future episode. There have been some improvements in surgical procedures. They're quite expensive. They cost $20,000 to $30,000 for the procedure, but it's a one-time thing compared to the potential for $10,000 to $12,000 in medication costs per year for some of these newer generation weight loss medications. But again, we'll talk about that in a future episode. It's my opinion that the greatest utility of these new generation weight loss medications will be in early treatment of obesity, because we're looking at 14 to 20% weight reduction with these medications. Again, the key is maintenance, but also a key is early treatment and treating obesity before the end organ effects take place of heart damage, lung damage, kidney damage, irreversible diabetes, and intercepting the problem at an earlier stage, I think, will be one of the keys. And exactly at what point that is going to vary based on a person's overall health status, their age, their many other factors, ability to afford some of these treatment options that are currently terribly expensive. Anyway, thank you for joining me for our discussion of weight loss medications. I know we just barely scratched the surface. I go back to the phrase healthy skepticism because of the prior history with medications used for weight loss. So go into this with your eyes wide open, have a conversation with your prescribing provider, and make sure that the risk versus the benefit is there. For people that are mildly overweight, frankly, I don't recommend them. I recommend continuing with your efforts at lifestyle change with diet and exercise. If you need it to just get you over a short hurdle and get you down to a more maintainable weight, I think that's fine. But generally, the risks potentially associated with these medications is largely an unknown at this point in time. I'll give you an update if things change, and it's going to be an exciting next couple of years as new drugs are approved and more people that are affected by the current epidemic of obesity are helped by these medications, hopefully. Thanks for joining me today for this episode on weight loss medications. If you enjoyed the conversation, remember to subscribe by clicking the bubble, and stay healthy, my friends.